So, first of all, before I talk about our MBA, I just wanted to say a little bit more about the Global Business School for Health. As you may or may not know, we're really the first business school totally dedicated to health and healthcare. And part of that is because really the health sector is growing, as many of you may know, at an exponential rate. And countries are spending more and more money on health and healthcare services. Today, most countries spend between 10 and 20% of their GDP on health-related products and services. So it's not just about recognizing that and the costs, but also recognizing that people need more health and healthcare, and that's often not distributed very equally. And so we need to think about how we can lower costs, create better quality, and also better access. And a lot of that is with a focus on healthcare prevention and diagnostics. And so managers in that management space, and particularly the business dynamics, are changing so rapidly. Even the kind of new categories of patients is changing. So these are some of the questions that we really want to push our graduates in the Global Business School Health to answer. We also recognize that in many traditional business schools, healthcare has played a very minor role. In fact, there's always been this perception that healthcare should sit solely into public health. So we really challenge that in the Global Business School of Health. We bring medical professionals, public health professionals, business and management, areas together to really form what is, I would say, today's health ecosystem. And that health ecosystem is made up of corporations, companies, organizations like Amazon, Microsoft, Google, you name it. Lots of companies have entered into the health space, and even insurance companies that traditionally offered, insurance products are now getting into health services. So the ability and the areas, and pharma, of course, is very much into that space, and particularly in countries like the United States. So as it evolves, then we need to really understand how we lead and manage healthcare. And that's what the Global Business School is all about. It's about creating cutting edge programs, giving people who are really interested and have that commonality a place where they can come together with lots of different people from different areas of health, as well as business and management, life sciences and pharmaceuticals and biotechnology, to really think collectively about taking on those healthcare challenges. So the MBA, of course, is our flagship program. It's where it really happens. It's an MBA is really about helping you become that confident speaker, the person who can really synthesize lots of data, lots of information very quickly and make confident experience decisions. So it's in a way, and that's why we use case studies, is to accelerate your experience, your ability to really own and manage in this space. So why a UCL MBA Health versus a general MBA? Well, as you can see from the quote from the former dean of HBS, medicine and business have long been intertwined, but today it is extraordinarily intertwined. And the way that healthcare will have to go forward in the future, it cannot be seen just as a public good. It has to be seen in that wider context and space. And the professionalism of healthcare is integral. So that's why we really challenge some of the conventional wisdom in this program. We also look at things like change management programs and how GP practices are essential, and long-term careers and goals for professionals who will work longer than their predecessors. So, why even do an MBA? Again, I often get the question, why an MBA, not an MSc? Well, it opens up so many more opportunities, career opportunities. Often what we find are students who start an MBA are thinking very transit. They want the next job, or they want to think more long-term. When they finish the MBA, it is transformational. They move from thinking in increments to leaps and bounds. And that's partly because of the self-confidence that they get, as I mentioned, through working with teams, working with others, learning how to really make those decisions. So we spent a lot of time actually at the UCL Global Business School for Health, in our UCL MBA for Health, really making sure your personal development is front and center. Your self-confidence is integral, getting you to reflect on your previous experiences up to this point in your career, thinking about your leadership style, thinking about the way you approach things, helping you to really embed much more systematic thinking, which is integral, particularly for healthcare. So it's that real shift from your thinking about yourself as an individual. And I hear many people, as they move up the management ladder, I just had someone the other day, that's why I'm smiling, say to me that they just taken on a senior management role, and how different instantly it impacted their thinking. And then they thought back about how they had looked at things previously. So that's the kind of work that you'll do in this MBA. So it's really great whether you're in health. Sometimes I have people ask me, do I have to be a consultant? Do I have to be a doctor? No, this is really about people who are either in the health space, and it could be in lots of different ways. We have people from public health. We have people who are in pharma, biotechnology, who are medical professionals, clinicians, and also non-clinicians. But we also have people who come just straight out of business management and want to come in and really pivot their career into this exciting health space. The other thing I want to make sure you realize is that this is an MBA. So to be called an MBA, we make sure that we cover all the topics that you would get in any MBA. So you can feel confident of that. You are getting an MBA. But what we've done, which makes our program exceptional, is we have built really into the DNA all those things around health. So I always look at this MBA as almost like a boot camp. And ours is definitely like that. It's a number of sprints that you will take through the year. And I'll talk more about the program structure. And you're going to get loads of technical skills. You really are going to get challenged both quantitatively and also the soft skills. But moreover, it's really getting that opportunity to really interact with a number of different experts. So when should you do an MBA? People usually do them either early in their career or they do them mid-career. Those are kind of the two launch points. So if that resonates with you, that's terrific. It doesn't mean that we don't get people much later in their career or very early on, but those are usually the kind of touch points that people come and do an MBA. We are a relatively new school, but I can assure you we're an excellent school. UCL is 8th in the world, #1 in research, and health in the health area and the faculty of population health where we sit is 4th in the world. So we are truly a health, medical, and life science university. We bring all that to bear into our programs. Our team and our core team in the Global Business School for Health is cross-disciplinary. And so when you take a module, you don't get just one academic teaching you. You get a whole team of both health professionals coupled with, business and management leaders. So it's a fantastic opportunity. And there is no MBA like it because it is really understanding that health sector. I've seen a lot of MBAs who claim to have healthcare. What they really have is a general MBA with a couple modules tacked on in health or healthcare, and then maybe a dissertation in healthcare. That is not the UCL MBA in health. Our DNA is really health. And so again, as I said, we make sure that, everything that an AMBA accredited MBA would have, plus we build into that at the DNA, everything that you will need to really go out and make a difference in healthcare management. We also have some really wonderful opportunities, and we have been overwhelmed with support from consultants in the health space, people in pharma, people in biotech, as I said, the NHS, hospitals, CEOs. And the reason is because there is a shortage of people with this skill set, and they want to be a part of this dynamic and important program. I get lots of emails of people saying, why did it take so long for someone to figure out how to do this? So one of the programs I just want to quickly tell you about is our Executive in Residence program. That's an opportunity for you to have one-on-ones with CEOs, former CEOs, senior leaders in healthcare management. You can book in a half hour. They will give you career advice, just general advice. We also will be working with a recruitment agency. They will be working with you straight out in your induction, helping you. They'll give you some psychometric exams. They will meet with you one-on-one and go over those. They will help you with visualizing your future. What do you want out of the program? We will be working with you across, and we have an in-house MBA career consultant who just will be working with you to make sure that you get what you need, along with a number of career events. And of course, alumni is a big part of that, as well as the people that you'll be, taking this course with. We can already see that this is actually going to be a really exciting program with people from lots of different backgrounds, both in terms of their work experience, but also geographically. So when you leave this program, you're going to have really close colleagues all over the world that you can kind of tap into as you need. We also have already, of course, thousands of alumni at UCL who would be eager to talk to you, to help you along the way. So wherever you go in the world, you can tap into that alumni community. The other thing is that we have an extensive executive education program. We're building that up. It's quite dynamic, and all our MBAs will have significantly reduced rates for lifelong learning that they can use and engage with throughout their life. So it is really, the package is amazing and an amazing opportunity. So what are we looking for? What's a kind of typical a portfolio of an MBA that we would want on this program? Well, as I mentioned to you, somebody early or mid-career is ideal. We take everyone, but those are, like I said, the kind of points that often people think about doing an MBA. The reason is because this is an in-person, face-to-face MBA. We will be launching in 23-24 an executive MBA. It is designed for people who are a little later in their career, who would like to work full-time alongside their MBA. So there's really 2 points, that you often go into doing an MBA. Many people decide to do a face-to-face in-person, take that year out, because it really does accelerate and move their career forward. And some people don't have that opportunity and come back later. So we will have an executive MBA launched in another year. It's a part-time MBA. It's mainly online, but interactive, virtual. So that's something to think about too, if you're concerned about this in-person experience. Having said that, though, this is really for people who are ambitious, determined, who really want to make a difference, who want to move up quickly, come in for a year or 2 years and get this MBA and really move forward. And you can do this MBA part-time and work alongside if that's your preference. So it's really about building your health and management, your consultancy skills, your knowledge of the wider health ecosystem. Many students come to us and they have a very, very narrow kind of look at the health sector through the lens of often a very niche program or skill set or professional body accrediting approach. So what we try to do here is give you not just depth, but breadth. So just some of the career destinations, and as you can see, there's lots of different things because it's an MBA, because you're getting really solid management and leadership and business skills. You will be prepared from this program to go into consultancy, senior management roles within, the wider, as I said, health ecosystem of pharma, biotech, public, private health, insurance, World Health Organizations, and also, startups. There's a big startup space, both here in the UK and internationally around health tech, med tech, of course, policy roles, academic roles, and then, just C-suite jobs within hospitals, which are very important. So it's really leveraging all of your skills up to this point and then combining it and getting that push ahead. So the program is a 12-month program, and it's, if you take it full time, it is across, it literally is September to September. If you do it part-time, you take kind of half a load and you spread it over 2 years. And I'm always happy to talk more about how those two are offered. As I've mentioned, it really is a program that blends both world-class academics with practical business skills and a breadth of different kinds of people that you'll meet and interact with. And that will really challenge your thinking about health and space. So now I just want to take a moment and really talk much more specifically about the program itself so that you've got a real understanding. So in terms of visualizing yourself on this program, once you get admitted into the program, you will be given the opportunity to take a number of online primer courses. There's some that'll be in time management, study skills for people who may be in work and out of education for a while. You might find those very useful. Accounting and finance is another area, because often, that's those kind of quantitative areas, again, may not feel comfortable to everyone. And then we have a very special module that was developed by myself and Mark Brunel, who's a visiting professor with us and also a senior leader in KPMG's global healthcare. And it's really about health systems. People in this program will come from lots of different backgrounds. So understanding how different health systems work is very important and part of the journey of being on this program. So the expectation is that you will do some or all of those primers before you come on to the program. The program will start really in September. It will kick off with a 2-week induction. Included in there is a 3-day residential where we take you really offsite. And again, it's an opportunity to build and bond as a class. There'll be lots of activities, opportunities to network, but there'll also be lots of speakers who will come in and really help you conceptualize that healthcare landscape. So it's tremendous. You'll also have taken the psychometric exams that I spoke to. You'll be meeting with the recruitment agency to get feedback and to think and map out your vision for the program in the next year. There are also, by the way, internship opportunities and other things that will come along the way. So thinking through how you want to approach this during that induction and really understanding the program and the demands and laying out your career is going to be important. Then in terms of the program actual structure, then you'll come back after your induction. You'll start shortly into your first block. So there's 4 major blocks and then your 2 projects, and I'll talk more about those. So how do these blocks work? You will have previously gotten through online case studies that you need to prepare, some readings that you'll need to do. There'll be some videos, some activities to prepare you for your first block. The first block is called Strategy, People, and Marketing. You will have over a month all these topics. You will get about 6 hours a day in the themed weeks. We'll normally start around 1 to 6, around in there. You will come in and have, the first week will be strategy. You will have experts both from the business side and the health side and combined, who will come in, they will lecture you, you will learn the theories, you will do a number of exercises. That week will be totally dedicated to each afternoon coming in and really presenting your cases that you will have prepared, the readings, discussing them. How does the case study approach work? Well, you've got cases. What is a case? So a case is, it'll give you a scenario about a company, a hospital, a problem, or even an opportunity in the health space as it relates to these topics. You will then work up a solution, an answer to a question, the theme question or a set of questions. You will then come into class, and with your colleagues, we will discuss how you came up with your answer. What was your decision that you made? Why did you make the decision you made it? We'll talk about lessons learned, and then you'll find out, most of these will be real cases, so you'll find out what the organization actually did. And it's through that, synthesizing that information, pushing, making decisions, presenting your views, that you'll build up your ability. So it'll be a lot of hard work at the beginning, but as you move through the program, you'll get more competent at presenting and discussing cases. So that's an important part of what we'll do. You'll also have other interactive activities, opportunities to discuss readings, to think about the wider context these subjects take place. The following week is what we call people. So that's really human resource management. Again, you'll get readings, you'll have some cases, you'll work with experts throughout that week. And then the third week is marketing. So these are really intense, and that's why you've got to prepare ahead of time for coming in. It's good, they're fast paced, it's a month that'll go like that. And the last week is called wrap-up week. And in that week is where we bring in the health professionals who will contextualize and share their experiences of either working in strategy in healthcare, working in human resources, or the kind of marketing side. And we've got some really fabulous speakers, experts, influencers, lined up to come in and work and talk with you. Then you'll have a 2-week gap between that block and the next block. That is to really prepare for the next block. And the next block is called funding, finance, and regulation. Again, the first theme will be accounting and financial reporting. You'll learn how to review all the different kind of statements. How do you present them? How do you look at them? How they're used for decision-making by boards. And again, you'll have cases. The following week is corporate finance, really understanding, the wider kind of organizational finance aspects of corporate finance, stock markets, how it all comes together. Each week, by the way, these themes will be led not by an individual, but by a team, but there will be a main convener who's an expert in this area. The third week is, of course, health policies and practice. And then, of course, your wrap-up week. That ends the coursework for term 1. In term 2, you've got, again, 2 blocks. The first one's called data-driven management. You'll have a week of economics and health economics, and again, have prepared and done the readings. You'll have one on data analytics. You will also learn how to visualize and present data, which is integral for any job. How do you tell the data story? And then you'll have a week on healthcare sustainability, which of course is becoming a more and more important topic. And then you'll have your wrap-up week. And then your final block is really what I call, a number of options. So you'll have options now, not just the 3, but you'll have other programs. These will all be different topics like digital health and innovation, and systems leadership is one that we've got slotted, supply chain management for healthcare. So these different topics, again, you will get to choose 3 of them, and then you'll have your wrap-up week. So those are kind of core modules. Now, I want to just talk a little more about the projects because they're really exciting, and they allow you, while you're going through this course, there'll be a lot of reflective learning, particularly, and that's where your work experience and will come into play. But these 2 projects are really integral. The first one is the Global Health Challenge. So at the beginning of the year, when you've got your induction, part of looking at, your different leadership styles, the different people that we have on the program, we will work with the experts to put you on what we will call high performing teams. Now, across the year, you will be working on this project. You won't just be working on the project. We'll also have workshops on your team ability, because it's so important today in the world that we live in and the world that you will work in or are working in, to be able to work with people from different backgrounds, not just in terms of who they are and their identity, but also in terms of their skill set. And bringing a high performing team together and making it function well and getting the most out of it is a very, very valued skill today in the workplace. So part of this project then is to help you develop your business and leadership skills as solving real world problems, but also learning how to do that as part of a cross-disciplinary group of individuals. So you will have, alongside that, 2 weeks immersion field experience, and that will be in January, ideally, or in June, outside of your kind of core teaching period. And you will go to the country that you're working on your global health challenge. How will we identify those? Well, in the faculty of population health, we probably have 40, different country projects running at any given time. So you'll work with UCL academics. You'll also work with industry in these countries, and you'll be working on a project to really identify and solve a health problem. You'll be putting it into a report, into a paper, a research paper, and presenting that with your colleagues. It's a great opportunity to learn what it's like to really consult and work internationally. We also have a project called the Health Consultant. That's the other kind of capstone project you'll do in term 3. It is really, we are soliciting a number of projects from different kinds of organizations, and you will decide which one works best for you in terms of your career goals. Depending on the project that you select, you might work independently or a small group, but you'll be working for a client and coming up with, outcome for them. So it's an opportunity for you to really hone in your skills, listening skills, working with others, working with external organizations, gaining a deep knowledge in whatever the project is, and then putting together, kind of your report and your presentation, which you will do for your assessment, but you will also then give to the client. So again, a wonderful experience to really develop. So as I said, this is a great MBA. It's really exciting. It's really, you've got to be able to focus. It's for people who are ambitious, who are really determined, who want to be exceptional leaders. It doesn't matter if you're currently a manager, a clinician, a business specialist, a medical consultant. We're less concerned about what you're doing currently and more concerned about what you want to do going forward. So it's a great experience, and it will make a difference to your career. It's transformational. It's not just transitional. It will help you really hone in. And I often say to students when I'm speaking to them, you might come into the program expecting one set of outcomes, and yet you might be so transformed in the program that you end up rethinking that and doing something different, and that's okay. So I want to now just spend a little bit of time talking about kind of the admissions criteria, and what does that involve. So it is really a great program and an opportunity for you to really move forward. So what are we looking for? Well, you will have to submit your academic records. You need a minimum of a 2.5 with a UK classification and kind of that equivalence in an overseas qualification. We do, take graduates with relative, who might not have that classification, but can demonstrate that they have extensive work experience that really is equivalent. If you're coming from a country that's not English speaking, you'll need to take the IELTS, and you'll need a 6.5 overall or a 6 in the subtest. Ideally, you want to have a minimum of 2 to 3 years of work experience. We do require a GMAT score or a valid GRE score, and I'll talk a little more about that in just a minute. Once we've got your application, we'll set up an interview, and the interviews are also very important, and I'll talk some more about that. Your CV, a personal statement, and 2 references. So there's quite a bit put together, but it's because we really want to make a decision on all of you. I sometimes have students ask me, how are all these weighted? They're weighted as creating a narrative, your story, who you are, and then us making a decision whether or not we feel that you are right for our program. So, I often say to students, think about it like applying for a job. You've done this, you know how to do this. So that's how I go in. I want to just say a little bit about the GMAT exam. We get a number of people sending us notes. They're quite anxious about taking this exam. You can go on and take there's a number of blogs and places where you can register for practice exams. You can take the GMAT online. If for some reason you really feel that you shouldn't have to take it or have a background that should exempt you, we do offer GMAT waivers. What we would need is you to email us. We would need a copy of your CV and a copy of your academic transcripts where you highlight, your kind of quantitative skills and reasoning skills with a reason why you would like to have the waiver. And we would prefer that you do that before you apply for the program so that we can flag that up as you go through the admissions process. So again, feel free to contact us if you feel you have a waiver. However, we would prefer that everybody takes the GMAT exam. It helps us. We're just looking for a balanced score. We're not looking for a particular score, but it does give us insights on the students that we're going to take and their ability. Because an MBA, like I said, it's a lot of work. You're synthesizing lots of material, you're writing up cases, you're presenting cases. So we want to make sure that the students that we're taking are ready for really coming in and being successful. And we want you to get the career outcomes that you're looking for. The other thing that we get a lot of inquiries about is the interview. So again, this interview is more about us getting to know you, understanding your expectations, thinking about how you'll fit into the MBA cohort that we're in the process of recruiting. And so these are, again, standard kind of interview questions. They're not that much different than if you've ever had a job, you would have answered on the job place. Why do you want to do the MBA? What makes you stand out among other candidates? What can you contribute to our program? What are you expecting from the program? What do you expect it to be in the next 5 years? And again, we're not looking for a set answer. We're looking to understand your thinking and your reasoning for wanting to do this MBA. So last but not least, I want to talk about funding, because MBAs are not cheap. This MBA is £45,000, regardless if you're home or overseas. It's as you can imagine, having just listened to me, it's not an inexpensive program to run. We have built in as much as we can. It's a real intense and exciting 12 months. So we have a number of scholarships, and we will be adding some other individual named scholarships around the first part of February. So keep an eye out for that as well. But we've got a £15,000 scholarship for MBAs. It's called the MBA Health Future Impacts Leader Scholarship. We do have a number of these that we'd like to award. So I can't imagine applying for this program and not applying for this scholarship. If you're an international student, that brings down the price of this MBA to what you would pay for an MSc program. You can combine scholarships, not just within this department, but also with other organizations. So I always say to students, when you're thinking about your finance, you're putting together a package for yourself. You want to think about all the scholarship money you can get. You want to think about how much you could work, say, part-time and earn to pay other expenses. Then you want to think about student loans and other opportunities. And then you total that up to come up with kind of the value and how much money you have for your program. So the Women Healthcare Leadership Scholarship is for anyone who identifies as a female who demonstrates leadership potential. One of the things about the healthcare sector, and many sectors actually, but healthcare is more alarming because up to 70–80% of the workforce in healthcare are females. And yet most of the senior leadership, the vast majority of the senior leadership is males. So we see that in places like the United States, women only make up 20% of senior leaders. In the UK, it's a little better. It's about 40%. And in the NHS, but if we look globally, women make up about 5%. Yet, as I just said, they make up most of the workforce. So we are really committed to helping women strive and become healthcare leaders. So in addition to that tuition reduction of $5,000, you will get career coaching, a leadership program that you will be able to take in addition to the scholarship. And then last but not least, if you live in East London or you work in East London, we have a special scholarship for people from East London. And the reason we're doing that is because we're going to be located in UCL East. And so it's part of our commitment to our local community. So other opportunities, that's just the scholarships in our department. There are, UCL has what they call a scholarship finder, and you can look on that. There are also loans that you can get. And again, we offer periodically sessions on funding, your degree. Please attend one of those. There's tons of information that goes beyond what I'm just showing you today. If you're an international student, you could get a Chevening, a Commonwealth, Fulbright, great. The UCL has a range of graduate taught funding programs. So you can apply to all those kind of PGT type program funding. And if you're from the United States, you do qualify for a US federal funding loan to come on to this program. Most importantly is the fact that this is an investment in yourself and an investment in your future. So the career support that you will get is unparalleled. It's really important to us, and particularly in these early days, that every single student that comes on to our MBA comes out with a very good career trajectory, that they meet their vision. We will work with you tirelessly to ensure that you get the career outcomes you're looking for. So we have as I mentioned, you'll have lots of opportunities inside and outside the class through the induction program, through the kind of leadership profiling, your personal tutor, your one-to-one career coach, the executives in residence, the people you will meet. We'll talk to you a lot about networking, building your personal brand. There'll be a number of special events that you can engage in. We also have a number of organizations stepping forward, asking us how we can, how they can, have our MBAs be interns in their organization. We will alert you to those opportunities as well. So your career is paramount, and that's what this program is really about, is creating and professionalizing the healthcare management space and creating that next cadre of senior leaders. So that's really, the program. I just want to briefly say, before I open up the Q&A, a few things. So yeah, that's just a signal for you to start thinking about your questions. You can start writing them into the Q&A function now while I finish up here. I just want to briefly say that being a student at UCL is a really exciting opportunity. We are so excited about this MBA class because it is super diverse, with people from all over, from different backgrounds, different countries, but all sharing a passion for making a difference in health and healthcare. So you'll have lots of opportunities to get to know your colleagues. I'm hoping our MBA Health students will set up a club. There's over 70 sporting clubs to join at UCL, volunteering opportunities, and of course you're going to be a part of the huge alumni that span, as I said, into the thousands. Also, if you need counseling, if you're having some hard times, and sometimes we do go through hard times, and particularly when we're a student, sometimes when we're juggling too much, we've got excellent student support and well-being to both for your mental health, your well-being, and anything else that you would need. We're really here to serve you. And then, this is going to be our new campus. This building here, Pull Street West, will be opening. Originally, it sits right near the former Olympic Stadium, and then this will be another building that UCL is building. So the campus is wonderful. UCL East is a great place to live, to study, to engage. It's quite exciting. This program is also, we'll kind of move back and forth between that side and Bloomsbury. It's about 8 minutes from that, so you can use all the facilities. UCL is one university with multiple sites across London. So it's fabulous. And London, of course, is ranked top city for students in the UK in 2021. The city is just tremendous. It's got parks and green spaces, if you're not familiar with it, museums, galleries, institutes. A lot of it is free, and there's often festivals and activities. So life in London can be really exciting, and lots of opportunities, and building, a kind of a downtime with your colleagues will be something that you'll look forward to. So that's really it. I've got just listed here, and I wanted to just highlight to you, get your application in, because any scholarships, by the way, you need to have been accepted into the program. But I want to highlight 2 events for you. This one is this GBSH Scholarships and Funding Information Session. Our next upcoming session is February the 22nd. So even if you're already applied, attend that. There's always opportunities to get and source funding. And then another event you might find very interesting to attend, which you'll be on the 22nd as well, but at 1 p.m. and that is our Health Innovation through Capital and Private Equity Markets. So if you go to the one event, you can follow it right on to the next event. So that's really it for me. There is our email address, and please feel free to reach out to us. If you want a one-on-one kind of conversation, please do that as well. I'm now going to stop sharing my slides and start answering questions. So please, again, if you can put your questions in the Q&A function, I look forward to answering them. So the first question, thanks for a detailed presentation. How many days a week on average will the full-time program run? So like I said, it runs in blocks. So the first block starts at the beginning of October. It'll run over 4 weeks. If you were, you will come in the afternoon, not in the morning. You'll start around 1 o'clock in the afternoon, and it'll run approximately to about 6 in the evening. It will run, over the week. So during that month, you'll need to have about, 4 to 5 days a week. One afternoon will be more, optional events, career events. Wednesday afternoons we'll be doing more career enrichment, speakers. But definitely you will need to be there Monday, Tuesday, Thursday, Friday of that week, every afternoon for that month of October. Then you'll have a couple weeks, as I mentioned, in November, the first couple weeks, and then from kind of mid-November to mid-December, you'll have your next 4-week block. And again, you'd need to be coming every afternoon, into the late afternoon. And then and then you'd have, of course, your break. If you're doing, the global health trip could either be in January or in June, depending on which group you're in. but say you were in the January group. So right after the new year, you'd be away on your project trip for 2 weeks. Then you'd come back, and in about mid-January to mid-February, you'd do that block, and then you'd have nothing there the next 2 weeks. And then in March, you'd have 4 weeks. And then after that, you will be starting your consultancy project. So you won't actually be coming to class, but there will be sessions and there'll be events. So roughly, and I think, that second term block might be February, and then off for 2 weeks, and then mid-March to mid-April. So that's really, and then the other times will be more flexible. You'll be working with your team. You'll be working on your project. So that gives you a rough idea of the time commitment. So I hope that helps. And of course, we'll be putting together a detailed timetable shortly, but that's what we anticipate. Thank you. Would you say one can work part-time with a full-time program? Yeah, I absolutely think so. And I have had many conversations with individuals who would love to have our MBAs working part-time. I know that we have a scholarship donor who's coming forward who will be funding fully funding an MBA student. And we will get that scholarship up on our site in the next month. And they would anticipate that student would work an internship with them. So you can, and if you're an international student, you can work up to 20 hours a week. Okay, so are there any other questions? I know we've still got some time, so I'm going to hang on here. If you would like to ask any more questions, feel free, and if you need any clarification, as I said, we're constantly thinking about how we can add more information on the website. But I really encourage you to apply. I really believe that this, if you're interested in getting into this space, this is where the jobs are going to be. And also, if you're an international student, you can apply after you finish this program for a post-work visa to stay in the UK for 2 years. But there is so much opportunity and so much need for people like yourself to really come into this space and make a difference. So I do hope you will consider this MBA, and we would just love to engage with you, support you through the application process, and help you make it happen. So thank you so much for your time. Have a wonderful afternoon, evening, depending on where you're at. And again, I look forward to engaging you through this process. Thank you.